I'm Jeff Natale. I'm president of ErieKIDS, and this is the President's Vlog, our third edition. And I really thought that today would be a good day to talk about depression in children. ErieKIDS is gearing up for our production of our third video, which is going to be a video about depression in children. And I thought it might be a good idea to discuss depression, both because it is a hot topic for us here at ErieKIDS, and also because with the holiday season we see an increase in depression, a specific form of depression called seasonal affective disorder. But we're going to talk about depression in children today in general, and not just as it relates to the seasons. And I guess one of the things that I would start by saying is that depression in children is significantly different than depression in adults. And it's even different a bit in adolescents as it is in adults and in children. But we're going to really kind of speak more broadly about depression in that child and adolescent stage as it compares to adults. And there are some similarities, but there's one main difference that I want to highlight today. For those of you who have ever known anyone who's ever been depressed, or if you've ever been depressed yourself, you know that there are some, very stereotypical signs and symptoms of depression, and they are things like sadness and a kind of a sense of hopelessness, impacted appetite, either eating too much or too little, sleeping too much or too little, maybe a general kind of idea that things just aren't going to work out in life. Other symptoms, one that is very prevalent in children is called anhedonia, which is really just a term that we use to describe what happens when a person loses interest in things that might normally interest them. And for kids, it could be hanging out with their friends, or getting outside and playing, or riding their bike, that sort of thing. So for your very active child, it could be that child showing signs that they're just not really interested in getting out. But the one big difference between child and adolescent depression versus adult depression is irritability and mood. Generally, when we see adults in therapy, their depression really shows itself as a very sad, kind of lethargic, another word we might use is called anergic, just this lack of energy type of depression. With children and adolescents, we often see anger, outbursts, which seem to be oppositional type of behaviors, and so it is kind of often where we'll consider those behaviors to be signs of the child that is rebelling. And more often than not, it really isn't rebellion or oppositionality. It very well could be depression. And I think, personally, I think that we misdiagnose children a lot. So one of the things to consider when you've seen in your child a big mood change from being, even if they're not the most outgoing child, but if they go from being outgoing or being kind of sedate to being irritable or angry, that is probably one of the greatest signs or warning signs that your child might be depressed. Let's talk about how we deal with kids who are depressed. Really, there are two forms of treatment that someone from outside of your family can help in treating your child. I guess I would say, before we even talk about that, I would say that one of the best things that you can do for yourself if you're depressed, or for your child, really is exercise. And there's been some new research that basically says that if you exercise vigorously for 30 minutes a day, there's been some research that says that kind of exercise is as effective in treating minor to moderate depressions as talk therapy and medication. But it is not something that I would prescribe necessarily when you have a kid who's really in trouble. We definitely want kids to be moving, but when your child is really in pain, it's time probably to call on the experts. So let's talk about the least invasive of the treatments for depression in children. And for me, that's family therapy. It's really my belief that children under the age of 12 probably should not be in individual therapy. They really should be in family therapy. Really at age 12 or 6th grade, it may become an option to treat a child individually. But try to remember, when your 12-year-old or your teenager is having problems in any other part of life, you want to be involved. So my opinion is, why would we not get you involved in treating your child, even at ages 14 and 15, when we don't do that in any other part of life? So the first thing I consider is a real viable option for treating depression is family therapy. And the goal for family therapy with a depressed child is to identify their symptoms, identify the precursors or what comes before the symptoms themselves or outbursts, and try and really manage those behaviors and the dynamics in the family. The second thing that is an option in treatment is a little bit more invasive, and that's medication. And you may have heard of the name brand SSRIs, or selective serotonin reuptake inhibitors. Not many people know that term. That's okay, but you probably have heard of terms like Zoloft or Prozac, and those are kind of the really well-known SSRIs, and there are others. But you may have also heard that there have been what are called black box warnings in treating children with the SSRI medication or the SSRI antidepressants. And this is something we have to take serious. It doesn't mean that you should necessarily, if your doctor or your therapist is suggesting them, that you should shy away, because the SSRIs do also save lives. And what it really means is that we have to be very, very careful when prescribing those medications, and we have to be careful in monitoring the kids when they're on them, because we need to be looking out for what's really called an increase in suicidal ideation, or an increase in thoughts about suicide. And this is really where family therapy shines. It's the moment where you can learn how to really understand what your child is trying to tell you in terms of their depression, and if they're on the medications, really trying to understand what they might be trying to tell you if you're having an adverse side effect. So, in brief, the idea is during the season and really kind of going forward, with especially for those of you who have children who are reaching adolescence, really want to pay attention to these issues of sadness and hopelessness, any kind of changes in mood, and the stability of their mood, stability in terms of their appetite and sleepiness. And really, again, if you see that their mood changes to anger, that's a really big red flag. One other thing to consider, of course, is changes in grades. That's probably a very good warning sign that there's something brewing. Family therapy as a non-invasive form of therapy for your child, and if your doctor or psychologist recommends, medication as a means to really help to build a foundation to work from in treating your child so that they can become happier and healthier as they develop. And as always, if you have any questions for us here at ErieKIDS, you can email me directly at jeff@eriekids.com, and we'll look forward to talking to you on the web.